Namaste and welcome everyone for today's webinar on mental health and psychological resilience during COVID-19 pandemic and its impact on productivity. This program is organized by Uniglobe College. You are watching us live from Uniglobe College Facebook page and YouTube channel simultaneously. And finally, we are here with the most awaited program on the moment. We have distinguished panelists from different parts of the world. Today, we want to listen from the panelists from American, Asian, and the European perspective as well. So let me have a brief introduction of our today's panelists over here. First of all, we have Dr. Amoneeta Beckstein, the counseling psychologist from the United States of America. He's working in the Webster University as well. Then we have Dr. Sangeeta Kaur, the professional certified counselor and a very elite trainer at Malaysia. She's working in the field of psychology, counseling psychology from last 15 years as well. We have another important panelist over here, Dr. Mary Chollier. She is the clinical psychologist from France and working as the psychologist at one of the hospital at Paris as well. So today we have three different panelists from different part of the world. Let's listen to what our panelist is going to talk on the mental health scenario on today's webinar. So as we all know that the coronavirus pandemic swept across the world as the number of COVID-19 cases increases in the United States, Brazil, Russia, European countries, India, and many other parts of the world as well. Today, we are at the position of stay-at-home or shelter-in-place orders continue by the government. The coronavirus pandemic is also causing strain on the mental health. It is causing widespread concern, fear, and stress, let's say, all of which are natural and normal reaction to the changing and uncertain situation that every one of us face on the moment. The coronavirus pandemic is leading us to live in a state of isolation as well. Changes in our daily lives, job loss, financial hardships, and grief of the death of loved one as well. So it has the potential to affect the mental health and well-being of so many of us. So today we want to listen what our distinguished panelists has to say on the mental health aspect, because COVID-19 virus has already spread over the different continents except Antarctica, infecting so many people in the different part of the world. As the virus spreads, the society, economy, business are being impacted. Now let's listen to our speakers, what they have to say in the case of mental health. First of all, I would like to start with Dr. Amoneeta over here. Dr. Amoneeta, first of all, I would like to welcome you on Trace. So my first question to you, as physical health has been taken care mostly at this moment, what do you think about COVID-19 effect in terms of mental health? How long can it affect? Do countries really need to focus on the psychological aspects of well-being for a long time? If so, how the long-term effect can affect the country's overall healthcare system? Dr. Amoneeta, may I request you to answer the question, please?
Yeah, first I want to really thank you, Ananta, for inviting us on this esteemed talk to talk about such an important topic that's obviously very, very relevant for today. I feel a great honor to be part of this and to be on an esteemed panel with Dr. Sangeeta and Dr. Marie, obviously very, very intelligent and hardworking and well-versed psychologists. So thank you all for inviting me to be part of this. In terms of this question about how mental health can be affected, absolutely, it can be affected. We're seeing that already, incidences of anxiety, depression, people being more vulnerable, those that have already had mental health issues prior to COVID coming out are being re-triggered. There are brand new instances, people that have never kind of suffered from mental health instances are reporting that they are. So it's already happening. And then they're also kind of predicting this, what they call a second wave pandemic of the mental health issues that are yet to come. The WHO has predicted, greater incidences of domestic violence, greater incidences of suicide. It seems like right now, for example, in the United States, although people are on lockdown, it hasn't slowed down the rate of mass shootings. Mass shootings are still going on in America, at the same rate, if not more, than prior to COVID. So there's definitely a huge impact on countries right now. In terms of the long-term impact, we really don't know, but it's very likely to have a strong long-term impact. If we look at studies from the SARS epidemic, which was obviously a lot smaller than the current COVID pandemic, back in 2003, they did a follow-up study with people in 2015, so 13 years later, and both direct victims, people that had SARS, indirect victims, just those that were fearful of it, and then most certainly the frontliners, the first responders, all of those people continued, obviously not everybody, but there were certain people that continued to have symptoms of anxiety, depression, post-traumatic stress disorder, those things, 13 years after that SARS epidemic. So absolutely, we're very, or I should say 12 years after. Definitely, we need to know that we need to be able to start preventing this, right? The more we can invest now in prevention, they kind of talk about it in the literature in the US, if you spend $1 on prevention, you're going to save $7 in the future, right? So if we need to start planning for that, we need to be trained in mental health, in telepsychology. We need to be following ethical guidelines, right, and protecting people's privacies. I saw lots of therapists were using Zoom, and some of those Zoom therapy sessions were being hacked and being observed, and so that doesn't follow with our ethical guidelines of being able to protect clients' privacy and confidentiality. We need to be able to legally be able to provide services across state lines, across country lines when our clients are moving away, right? If we're doing a telepsych, there are some people that their licenses don't allow them to operate when people are in other locations, right? And we need to be able to be free to be able to help people around the world, although that poses other implications. So to try to sum up, absolutely, we are being affected, and it's very likely to have longer term consequences on the countries and the overall health system. Thank you.
Thank you, Dr. Amoneeta, for your version. Now, I would like to move forward to Dr. Mari's opinion. Dr. Mari, since you are the psychiatrist at one of the hospital at Paris as well, and you are the senior lecturer at the Chester Business School at United Kingdom as well. So my question to you is, it has been well documented in the latest literature that there is increment in mental health problems such as traumatic disorder, let's say anxiety, depression, and many other adverse outcomes related to the mental health. I've also seen that tendency of doing suicide is higher at the lockdown period when compared to the normal days. So do you think enough attention have been given in the psychological aspects? So any suggestion about how can we stay calm and happy in the midst of the pandemic?
Okay. Hello. Thank you for inviting me. I'm not going to take too much time, but thank you very much. There are several aspects to differentiate in this worldwide crisis. The first one is the pandemic itself, because the pandemic itself has different impact, death, sudden death, bereavement. How do you say goodbye to your loved ones? So we know we might have bereavement disorders, and we already start having some in France when people cannot say goodbye. They can't have their usual funerals or rituals and everything. So that's one first impact, like direct from the burden of the pandemic. The fear of acquiring, the fear of transmitting, and it goes back to any kind of other pandemics, whether SARS, Ebola, anything, HIV too. So this creates a climate of fear that is invasive in daily social interactions. You go to the store and you see someone that doesn't wear gloves and you're angry. And this creates kind of a mistrust between people. And that's also impeding social interactions and daily social life. So this is just the pandemic. Then you have the measures of the pandemic. Lockdown. Lockdown is dreadful. Many studies reported all the psychological impact, not even talking about the psychiatric impact, but lockdown is dreadful for any person with a chronic condition, because you might not be able to access your medication, to have your medical appointments. Violence increases. Violence on children has increased of 20% in France, 32% increase in terms of self-report and helplines in domestic violence. And it's not direct mental health issue, it's psychosocial issue related to the measures taken during this pandemic. But we know this is going to end up in mental health services at some point. So it's a cascade with a lot of things. Then the exit of the lockdown here, and I think this is going to be the case in it's already the case in the US, but people are going to lose their job. And how can you talk about mental health when people are not feeling able to feed their children? And mental health will come second compared to daily priorities, which is food, job, and sleeping somewhere. And if we don't support people during this moment, there will be a big issue later. All studies reported a surge in mental health services after any kind of crisis, earthquakes, pandemics, doesn't matter. We know there is a surge in the following month up to a year, but if people are dealing with psychosocial or just social challenges and difficulties, it may just be a very long-term crisis. And acute stress now, during the lockdown or the ending of the lockdown and everything, is not trauma per se, but we know that there are so many different acute stresses right now that it's going to lead to a very heterogeneous trauma landscape in a year time.
Okay. So, Dr. Mari, I'll come back to you later on. So I will move forward with Dr. Sangeeta on the moment. Dr. Sangeeta, are you listening to me? Okay. Dr. Sangeeta, WHO defines that health as the well-being of both physical and mental health. So in this situation, how easy is to the frontline, let's say the frontline workers such as doctors, nurses, and pharmacists, who is basically involved in the primary treatment of COVID-19 to coordinate with mental health workers for maintaining well-being among the infected people? What do you say, Dr. Sangeeta, on this note?
Hi, Ananda. Hi to all of you. Thank you so much. Okay, so there's many different aspects, in Malaysia if we are looking at it, right? So when we talk about frontliners, we talk about doctors, nurses, pharmacists, and all that. In Malaysia, in the hospitals, we do have psychosocial support team where they assist frontliners, right? So it's like a daily thing where they need to check in. There's a checklist that you need to take in order for you to self-care, to manage, and to understand. Are you able to pursue and to start your work, or you need additional attention? So we do have that in the hospitals and all that. And during this stage, during the surge of the pandemic, this might not be ideally being implemented, because during that moment, the doctors, the nurses, and everyone else in the front line, they need to address clinical setup. They need to know what to do, how to get it done. And I'm sure a lot of them has been exhausted, And we do have doctors who are afraid to go back because they don't want to bring this virus back. You don't know what's happening. You don't know, how you're going to transmit, because you can't see it. And as I always say, look at the COVID-19 crisis similar to your mental health crisis. You can't see it because it's inside, but it's there. You do have symptoms. In COVID-19, you still have fever, you have cough. It's the same thing as mental health. You still have symptoms. And can it, kill people? Yes, in COVID-19, and the same thing in mental health. So during the first stage, it's not easy, because the key thing is to save people, to look, clinically. I need to know what needs to be done procedure-wise to get things done. It's not easy. But later on, once now when it subsides, people are looking more into mental health, right? They are focusing on mental health. They try to advocate on mental health. And we also have hotlines from different NGO, from different ministry, like Ministry of Women and Health, Women, and then Ministry of Health. They do have hotlines for people to call in. And it can be from anywhere, anyone with any type of symptoms, whether they are COVID positive, or they are in isolation from traveling and all that, or those who are feeling like they need to have assistance. They need to have, they need to know, where can I get additional assistance? Where can I get information? So we do have hotline where we address these concerns, and all we are volunteers. So it's on 24/7. So in terms of maintaining the mental well-being of the infected and also those who are not infected, there is, but not to the extent ideally that we want it to be. Because again, in Malaysia, I think in Asia, mental health is something new. We don't really talk about it. We don't really explore due to the stigma, due to the stereotyping when you have mental health. I'm not going into illnesses. That is a different ball game altogether. I'm just talking about challenges. For those who have OCD, suddenly right now you need to make sure that you need to clean yourself.
Right.
The fear. Yeah. So those who might not have it, the fear, anxiety, they might develop symptoms. It might not be severe, but it is a concern, right? So in terms of addressing this, we do have agencies that look into mental health. We do have NGO, non-government organization, non-profit organization who looks and reach out to people. Yeah.
True. Thank you, Dr. Sangeeta. Now I will move forward with Dr. Amoneeta's version. So, Dr. Amoneeta, since you have a very long experience and you have done so many research in the field of psychology as well, so is there any methodological difference between how psychological health is properly maintained between the infected young and the old people? Since the psychological health has also, can also be affected between both non-infected, let's say I'm on the moment, and other infected person, how do you see the scenario? How complex is it for the mental health workers to deal with both kind of people at the moment? And I assume that the more work than medical workers working in the front lines are doing on the moment. What do you say, Dr. Amoneeta?
Yeah, excellent question. Thank you. My expertise is much more in young adults, working in universities for many years. But I'll try to my best to address that question. I think that both young people and older people are vulnerable, right? That's shown in the literature that right now they're vulnerable for mental health issues in general, vulnerable for mental distress, psychological distress during the COVID pandemic. For example, there has been a study in Hong Kong, Macau, China, the countries that have been affected by this the longest, and they saw that the highest number of people with psychological distress were those that were older, over 60, and then the younger ones, more during 18 to 30-year-olds, kind of college-age students. So those tend to be the ones that are affected stronger. And so I think that both will be most certainly affected, most certainly during these times. Of course, not everybody. That's something to keep in mind. There are some folks that are actually thrive in kind of crisis situations and are resilient. So we don't want to assume that everybody's going to be in distress, and that's kind of part of what we talk about today, right? Is the resilience to this. That some people can be growing during this time. Some people can be experiencing what we call post-traumatic stress or post-traumatic growth, and even peri-traumatic growth, where they're growing even during the pandemic. But you're asking kind of how do you deal with folks that are more stressed, right? And we do know that younger folks, most psychological diagnoses and problems, they tend to start in younger ages. So this could be a triggering point where people start to develop diagnoses and develop distress during this time. A lot of times people below the age of 25. I think in terms of common symptoms, depression, anxiety, OCD symptoms, these kinds of things, they're probably going to be manifesting in young people and old people fairly similarly. One difference maybe is that younger folks are very, very vulnerable to the influence of others and influence of media. So they really want to be accepted by their peers, whereas older folks have that need for social connection, but maybe not as much. They're probably more established in their relationships. They're not trying to branch out and earn respect and acceptance from their peer groups. So the younger people are going to be very, very vulnerable to that. They're also very influential by the media. So, for example, when the the show 13 Reasons Why was aired, was released. This demonstrated a young girl that committed suicide, and we saw huge jumps in the youth population of committing more suicide in the months after that airing of that show. So what that shows is that young people are going to be influenced by the media. I know Dr. Sangeeta might have heard of a 16-year-old Malaysian girl who posted on her Instagram and said, should I commit suicide, yes or no? And 69% of her viewers said yes, and then she did it. So some of these types of things can be influencing our young folks, and there's already been studies out there that are showing how people are being more distressed when they're looking at the media, right, and all the media that's out there that's bombarding. So I think in general, these things are going to be similar and somewhat different between elderly and younger folks. In terms of the threat of death that's already been brought up, right? So people may be at different stages. I think they all might experience some of those kind of denial, anger, bargaining, depression, acceptance, right? But they might be go through those in different ways depending on their age. So yeah, thank you very much.
Yes, thank you, Dr. Amoneeta. Now I would like to go with Dr. Mari. Dr. Mari, either people are staying at home with no work or are in the phase of working from home, let's say. So how do this scenario affect the psychological health than what people used to do when it was normal? There are so many studies that has been carried out, and studies have shown that more judgment in social media among young, increment in mood disorders cases among the people of United States and European countries are being seen. What do you think about it, and how can we minimize the mental problem among the people? What approaches could people take for preventing themselves from being victim of the mental problem these days?
So I will emphasize, Doctor, can you hear me?
Yes, please.
Okay. I will emphasize what Dr. Amoneeta said. Young people are very prone to social media use and its influence, and it can be empowering or deleterious. And maybe it's our role as professionals to make it empowering. This is not about the tool. This is about the use we have of it. So right. This is a space professionals need to not invade, but get involved in. Working from home is an interesting new way of working, but it's also a very important sign of social inequalities. Can you actually work from home? Can you?
Exactly.
Does your job allow you to work from home? And if it does, do you have the technologies at home to work from home? And what we've seen in France in children like homeschooling or being at home is that between 10 and 15% of them do not have access to a computer or to the internet. So they can't keep going with their homeworks. They can't follow school because they don't have the means and resources at home. So this is a whole part of the population that is a bit forgotten. So we can try to reach out. We can try to go there, social distancing and everything. But there's a strong inequality in this. Once you work at home, they realized in the country that in France that when men were working at home, they were in a room with someone else in 20-25% of the time of the whole male, but when it's a woman, it's 35%. So the man is going to take the office room and the woman is going to stay with the children. So we also have gender inequality when working at home. And who's going to look after the children? Are chores going to be shared? And working from home is it's a complete new organization of your daily life. And if you live in a very small place, and promiscuity, the lack of potential intimacy, safe space, that's also a reason why we have this increment in domestic and domestic violence and child abuse. So I'm sorry for the very bad side of working from home, but I think it shows a lot of inequalities. And this is something we should definitely consider as mental health professionals. And if we can reach out to people physically, and we can, there are still means to go and see people and remain safe and support them if they need it. Online platforms are our way in.
Right, true. I agree with you as well. So moving forward, I'd like to go with Dr. Sangeeta. Dr. Sangeeta, so as we can see that from the data, peak death period has been passed by the European countries and somewhat by US as well. But prediction has been made for the later days in the Asian countries particularly. For instance, the start of death peak in India has been expected in the last week of June or let's say the early July as well. So can we get any idea about how we need to prepare so that people will not be affected psychologically to a large extent based on experience learned from US or European countries as well? So if there is anything that we can learn, let's say, can we replicate it in the same cases in the case of South Asian countries as well? If yes or no, how easily can we adapt it based on the socio-cultural differences between the two regions?
Okay. All right. So this, okay. So when we talk about, can we adapt certain differences and all that? I believe we can, right? But again, in Asia, we are looking into society based. We are looking into, people around us. How can we adapt? How can we move forward? So if you look at this, there's few things that we can do, but it needs to be supported. You see, most of the time when we bring in Western cultures, when we bring in certain culture in, it's people did not really adapt to that scenario and localize the solution or localize the words that being said. For example, right? If in US, if you use the word aggressiveness, it's a different thing. But in Asia, in Malaysia, if you use the word aggressive, meaning like, we're going to bash you up, we're going to hit you. So that's a different meaning to it, right? So when we adapt solutions, when we adapt intervention or skill, it needs to be localized in order for our society to understand it better. And when they implement, the risk is lesser. So you are actually reducing the gap, right? So this is why I'm into the adaptation, but we need to localize it, yeah. Right. And then when we talk about intervention, for example, like counseling, this is something new. When I say new, it's not like it just boom. It's been there in Malaysia for quite some time, but people don't really look into it. We have EAP services, but employees don't really look into EAP. They don't want to call and voice out their concerns, their mental health challenges. They don't do that. You see, we adapt the EAP from the Western country, but locals don't really use the EAP. We have GLC's companies who offer those services, but the locals don't really look at it, right? Because end of the day, when they have situation, when they have issues, they will always fall back to religious entity, religious institution to be back on track and to get intervention and so many things. And in Asia also, if you look at it, when there's scenario, when people go through mental health issues, they will go to all these healers first before they seek professional advice. So that is why, so I think I'm not sure in Nepal, is that the same thing, Ananta? Right? We
yes, we can replicate the things. Yes.
Yeah.
Since we have a.
Sorry.
Yes. We have so many commonality in terms of Asian cultures as well. So that is how it is being reflected in the South Asian countries as well to some extent, right?
Yeah.
So moving forward, Dr. Amoneeta, there is one question from the side of audience. Sambit Chetri is asking a question that, as the pandemic has been putting an unforeseen pressure on people of almost every age group, psychological resiliency becomes a massive concern. with the situation like this to worsen, how can we expect the people to adapt to this adversity in the long run? Dr. Amoneeta, Sambit Chetri is asking a question. So can you please elaborate on this question, please?
Yeah, the question is that people are under distress from the pandemic, and how can we adapt to lessen the distress? Is that the question?
Yes, he might be asking the same question to you. So can you please elaborate on this note particularly, please?
Yeah. So I think that there are quite a few things that we can do to try to adapt, right? So if people are still socially isolating, we know that we are social creatures, and so it becomes really important to continue connection in whatever way possible. I know that not everybody has the technology and the means, but if you do have the technology and the means to do these kind of video face-to-face contact with people, loved ones and people that are close to you, or even finding new people to connect with, that kind of connection is crucial to our mental well-being and happiness. And we do know that
Exactly.
that face contact, although it doesn't mimic exactly the same as being in the same room as somebody, the video does mimic that. So that can be quite helpful in trying to do that, and trying to kind of normalize, get support, give support, right? If you're in a position where you're able to help others, whether it be listening, sending out a message, writing something, and then there are other ways, obviously, to connect. You see, I'm seeing people that are doing drive-by birthday parties and shouting at each other across balconies, and kind of making ways where they can still connect to people despite the current circumstances. So I think that's really, really crucial. Obviously different things like finding a meaning, trying to grow yourself, trying to find different projects and having routine. And then also just normalizing. There's so much advice out there saying, do this, do that, do this to feel better, or feel better, do this. But it's also kind of okay for people to kind of fall apart and not function for a day or two, or have, go to some unhealthy adaptation coping strategies for a short term. We know that actually some research shows that any kind of coping it helps people in the long run than no coping, right? And so, but be warned, of course, if they start to see unhealthy habits of going to drugs or alcohol or other addictions and those types of things, that if you start to see those as patterns, as going on and on and on, then you might see that as a sign, and then reach out and try to correct that. But kind of short-term coping is okay to allow somebody to kind of fall apart, to not get out of bed one day, right? As long as it doesn't become a week or a month or more. So yeah, hopefully that addresses that question some.
Yes. Do you think, Dr. Amoneeta, do you think that any big difference in the way of COVID-19 is impacting on the mental health among different people? Let's say, for example, young, middle-aged, and let's say the diseased or healthy elderly as well. So how they are being affected in this stance? Let's say, without being in distress, how can we deal with the children and elderly mental, let's say, health scenarios, let's say, in these days? So, so my question is, in context to Asian scenario where joint family living are preferred, I also like to add, what are the mental health consequences of the COVID-19 lockdown and social isolation for the vulnerable groups, and how can these be mitigated under the pandemic conditions?
Yeah, so it's already been said that lockdown and social isolation and these things are not good for people's mental health, and in fact you see that increasing. And so some of the recommendations are to decrease the length of quarantine, the length of lockdown to as short as possible, if possible, if safe to do so. The World Health Organization has predicted, as I think I mentioned, higher rates of mental health issues, anxiety, depression, obsessive compulsive, and then probably the worst indicator, the biggest risk is suicide and homicide, and so those things can be risky. And also, you talk about people kind of. Some people are isolating, but some people are isolating in spending a lot of time together that they're not used to. So there's also greater incidences anger and domestic violence and fighting and those types of things to relationships. So there's obviously potential for people to get closer and bond and really build their relationships. And then there's also risk of people kind of hurting each other, both physically, emotionally, and mentally, right? And so this could be likened to what they call a complex trauma, defined by Moss King as a long-term exposure to a prolonged social or interpersonal trauma in which it is unlikely for an individual to escape that environment. So that's kind of, does that sound familiar? The entire world is experiencing this kind of complex trauma. And so, some of the things that we can do to try to reduce the impact, again, I think is through the socializing, the normalizing of mental health, the normalizing of these experiences, offering things like Dr. Sangeeta mentioned, hotlines, telepsychology, right? But also something else. We also know some research shows that the mental health professionals are not going to be enough there, that we're not enough trained people, but rather what we can do is we can train people, lay people in psychological first aid. It's something people can be trained very, very quickly. And anybody can support another person. Obviously, if it becomes more extreme and something they can't handle, then they might recommend to a professional. But each and every person out there can play a part in supporting their loved ones and even strangers during this time.
Right. Thank you, Dr. Amoneeta. Then I would like to move forward with Dr. Murray. Dr. Murray, actually, so it is sure that there is going to be a negative impact on our mental health due to so many news going around us. Every day there are so many multiple news that come across to our mind. Say when someone read the newspaper around the world, the most focus is given. Let's say not only the newspaper, we have access to so many digital mediums as well. So these days we are bombarded with so many news. So when someone reads the news around the world, the most focus is given for the number of deaths and infected people from COVID-19 cases. I personally believe that this cannot have a positive impact on the mental health. Even if you are trying to increase people awareness about the current situation, the situation can make immune system much more vulnerable, let's say. So make us, it also make us so exposed to not just COVID-19, but many other, type of diseases as well, I believe. So how should we respond to this situation? So also, could you please elaborate on the effect of repeated media consumption about COVID-19 through so many traditional and so many social medias on mental health, and how can we, can ensure the well-being, and how can it be promoted, let's say? So what are the best methods for promoting the successful adherence to the behavioral advice about COVID-19, enabling mental well-being and minimizing distress? So what is your opinion, Dr. Murray, on this note?
So obviously, when you study what's happening during crisis, you don't want to look at positive experiences because you want to look at the negative ones to treat and help. There are people who are quite well handling the lockdown and the pandemic. People in France, people are going back to gardening, spending time with their family, less stressed about job, might consider a new vocational journey. Existential crisis, I think this is important. A lot of people are, running in this very city life with big jobs, and suddenly, the economics crash and people are just looking at what's really important to them. And it can be enlightening and very peaceful, and you can have time to do things you would never take the time to do in different circumstances. But if you experience it this way, it means that you have money, you're not afraid of losing your job, you might have enough space, you might have a garden, you might not have too many caring duties, and it goes back to many social inequalities. If we are all able to look after ourselves, caring duties and how we can relate or what we have to do for others can be a real burden. So how can we look after oneself and look after others? We have to say that very simply. We already do it, otherwise there would be higher rates in all these mental health issues. So at some point, we are all able to look after ourselves
Yes.
with simple things, keeping pleasure in very small things, finding moments for oneself. So isolating, even when you're already isolated, which can be a bit strange, but people taking 1 hour off in their bathroom, things like that during lockdown.
Right.
The question is, how can we support people in accepting negative emotions and negative moods, because it is normal. It's a normal reaction to a very global abnormal event, which is the sort of definition of trauma. And we know it's going to affect us. If we can accept that we are affected and we can go through it together, that's already something. That's already at the interpersonal, very small community level, something. And talking about what we can do, PFA definitely is the key. Training, volunteers, layperson, how can we support each other? Just be there with simple things. Person-centered crisis counseling, very basic. We implemented something like that for the general population in Paris, because it's not about mental health and disorders and diagnosis and medication. It's about sleep disturbance, being anxious. It's about difficulties and psychological difficulties to go on with your daily life. And if you are just given the little support, if you're given this kind of mirror showing you that you already deal with it and it's okay, you still have the resources, it's already easier to go on.
Right. True. But actually, people are being exposed to this sort of things, and they are, being responded so negatively because there's so many informations that are being bombarded in their mind, and they're very used to it. And then these sort of things are going to be impact a lot in their psychological health as well, I believe. So one question is from the side of Divas Kafle. He's asking that, as a psychologist, do you think that we are gonna have the same social and personal life after this pandemic? Do you think we are going to have the same social and personal life after this pandemic as before, and what precaution and measures we need to take in order to generalize our life? This is the questions raised forward by Mr. Divas Kafle. Can you please elaborate on this, Dr. Mari?
We won't go back to the previous state. We won't. So in our daily life, socially, we won't, because we might all be wearing masks for a certain period, keep our distance.
True.
We won't because the economic situation will be different. We won't because we will have been through existential crisis and we'll have answers to that. So there's no going back to normal. There might be a new normal, but there might be unstable normal for a while. And dealing with uncertainty creates psychological difficulties and mental health issues. So that's no, we're not going back to normal.
Right, true. So I would like to move forward to Dr. Sangeeta. Dr. Sangeeta, COVID-19 is no doubt affecting every walk of our life, let's say. Its impacts towards everyone and other psychological and psychiatric health as well. So how should we quantify them? As an expert, could you share on how you are handling the psychological effect that may impact on public in the pandemic scenario? Also, being more personal, how are you maintaining your life in social distancing situation, and what strategies are you adopting on your own? How are you managing your anxiety level, let's say? How important is the physical activity, fooding habits in this situation for balancing the mental health? Dr. Sangeeta, please.
Yes. Okay. So, you see, we are all different, right? The way we do things, the way we apply on our self-care, the way we do intervention, we are all different. And in Malaysia, we don't really express our emotion freely. Okay, we will have all these words and frustration in our mind, but we will not say it out. All right. So a way forward is that we need to create a norm where people are comfortable to expressing their emotion. People need to feel comfortable in feeling, and they need to address those emotions because any emotions, it's all valid, right? When you address those emotions, when you address that thoughts that you have, it makes it easier. But again, you need to trust the journey, right? Because when you trust the journey, we don't promise you, a rose garden, but it will go up and down. It's like a roller coaster emotions, where there are days where you feel that you are so lousy, you feel that you are good for nothing, you're worthless and all that. But then if you work through that, you will be better, right? Because it's all over time. Nothing is stagnant, nothing to say that this is you 100%. No, we have the ability to adapt, we have the ability to grow and learn and develop. So in terms of that, every one of us need to put an effort to look into this. And here, what we always have is, since young, we have been groomed that boys should not express their emotion, because it's not macho. It's not you are a sissy if you say that, or you cry, or you cook and all that. It devalue the emotion, and it makes that men do not have emotion. You are a stone or something like that. So we need to start by allowing them to express, because when you compress everything in, that's where the violence starts to kick in. You will run amok, you will do things differently that is beyond your control, because there's a lot of things that is in you. So
right.
This is how we need to advocate people. We need to create the awareness. We need to create a norm. And my daily mantra is nothing personal. If you want to tell me something, you are saying out of what you know, what you understand. And even though if you're angry at me, even though you have something like, it's your say. You have the rights to say, but it's me that I'm holding the power not to give it to you and to make my life miserable. So this is what we need to understand, people, right? So when it comes to my daily practices, so for me, I take one thing at a time. I learn how to just sit quietly, not doing anything. It's difficult. Someone from my personality, you always like to move around, get things done, and always on the move. And right now, during this lockdown, and it's like not doing anything is difficult, but I learn. Okay. And if I go out, I make sure I have the essential. I need to wear my mask. I need to bring my own pen, because right now, wherever you go, you need, besides the QR code, you need to write down your name, your temperature, and all, your phone numbers and all that. So these are my own initiative that I do, because I believe that if I start from within, it doesn't matter if you want to do it or you don't want to do it. I can't get angry if you don't want to do it, but it all starts. So when you start doing it, when people look at you, it will strike in their mind. It might not be today, it might not be tomorrow. Over time, the more of us we start doing this, people will start to adapt. Yeah. So a few other things that I do, sanitize my hand, create, talk to people more. Sometimes not face to face, because we have a distance, but virtually. So this is how I manage my mental health. I talk to people, I learn more, I develop, because maybe I have the luxury to do that. But for those who do not have the luxury, they are confined in the small house, where you have like 5-6 people in a small house, or they cannot go out. There's no window. So how do they do that? So again, do things what works for you. You might get frustrated because you might not get the luxury of doing it. You might not feel happy because, even though this is my space, my time, but I still need to share with someone. My heaven is my bathroom, my toilet. I can just sit there and I can read, I can watch video, I can draft things. That's my heaven. Because when I go to my bathroom, no one else can go in. That's my space, yeah.
Definitely. Thank you, Dr. Sangeeta. So I would like to move forward, Dr. Amoneeta as well. Dr. Amoneeta, the same questions. How important is the physical activity and fooding habits in this situation for balancing the mental health, let's say? Sorry.
I'm sorry, I couldn't quite catch the question. It's cutting out a little bit.
Are you getting my questions, Dr. Amoneeta? So how important is the physical activity and let's say the fooding habits in this situation for balancing the mental health?
Oh, okay. How important is the physical activity for balancing mental health? I mean, I think that it's crucial, right? And there's a ton of research out there and showing the link between physical activity, physical health, and mental health. They tend to go very much together. You know, mental health can affect physical health, and physical health can affect mental health. In fact, we know that things like anxiety and depression can reduce our immune system, right? And so that's crucial at a time right now when we're trying to build our immune systems up. We're trying to have stronger immune systems so that if we do get exposed to COVID, where our bodies are able to fight them. And so physical activity definitely boosts our immune system, and it also helps us deal with psychological stress, anxiety, anger, basically all those kind of uncomfortable emotions that we feel. Physical activity can help. And so I know not everybody has the privilege and luxury of going outside. I know in Thailand right now, all the gyms are closed. A lot of beaches are closed. I've been fortunate and privileged that I live in a small enough place that I can go to the beach in the mountains and kind of avoid people. And I have my own car that I can avoid people. Not everybody has these kinds of privileges to stay active. But yeah, if people are able to get even 10 minutes of fresh air through their window and sunshine, that can help. And then there's lots of people that are posting blogs and on social media on how you can exercise at home, right? I personally have been doing these high intensity exercises, 15, 20 minutes that I can do right in the space of the living room. There are things that people can do in a very, very, very small confined space. And so, I know lots of folks are not motivated to do exercise, but just again, 15 minutes, 20 minutes of exercise, even if they're doing that in their own bedroom, can make a difference for people's mental health. And then, of course, the physical health benefits are there also.
Yes. Obviously, but these days people are confined with the four walls of their boundaries. They are not in a position to go outside from their houses as on the moment. So they are confined to stay within the houses with their family right now. So, but my question is, do we have to bring any amendment, any changes in terms of our daily fooding habits in order to be very much, conscious towards the mental health?
Do we need to do anything?
Any revision in terms of, let's say we have to have a deeper concern regarding what sort of foods that we're taking on an everyday basis. Are these things going to impact on our mental health or not, Dr. Amoneeta?
You're talking about diet, right? Is that correct?
Yeah, exactly true.
Yeah. I think that diet can affect mental health. There was a documentary in 2017 that talks about, I think it's called What the Food. And it talks about some of the links, right, between not only the what people eat and that diet and balanced diet and reducing things that are in the diet that actually puts a huge stress on the body physically, but it can also put a stress on the mind mentally. So most certainly there are lots of foods, primarily fruits and vegetables and fresh things. The kind of the more vegetarian and vegan diets tend to show better support mental clarity and decrease mental health symptoms and those types of things. So most certainly the diet can have a huge impact. And I know, again, not everybody has the privilege and the access to those things at this time. But if there is ability for people to access, fresh fruits and vegetables, most certainly it can have a positive impact on their psychological well-being.
Yes, thank you, Dr. Mari, would you like to add something? Sorry, Dr. Sangeeta would like to add something on that?
You need to have sunshine too, yeah? You need to have sunlight. That's very important also. Yeah, because
Okay.
you know, when people are afraid to go out to socialize, to do their daily routine, for example, you know, you need to buy groceries, or you need to go to work and all that, so they don't have enough sunlight. So sunlight is very important. It's part of your mental health also. It drives you to and motivates you to get stuff done. Yeah.
Right. Okay. Apart from sunlight, Dr. Mari, do you have any specific suggestion to all of us? So, is there any fooding habits that is very essential for the protecting the mental health on the moment in the COVID-19 crisis?
The number
Are
of
there any categories of please?
So one thing we didn't really mention it, but it's kind of hidden in everything we discussed, is sleep. Sleep disturbance, sleep deprivation after 2 or 3 days leads to psychiatric symptoms. It increases anxiety, stress. It can lead to very strange derealization moments and everything. And if you're anxious, if you have caring duties, if there's violence at home, you just may not sleep. And it's a very eating and sleeping, basic needs, can be altered in this global situation. And maybe if there are any things to promote, it's back to the basics: sleeping, eating, and basic socializing, and going out, taking the sun. It seems quite simple, actually.
True. So, frontline healthcare workers are facing numerous pressure and handling thousands of patients in a day at the moment. Let's say, since you are also involved in the hospital sector, I'm pretty sure that they are also in the mental distress as well. So, is there any coordination between you as a psychologist and them? So, both of you are dealing with people who are maintaining a good health. How can both of you remain motivated and focused in this pandemic situation?
So they are. So in France, we have helplines for professionals. I think from all the external support schemes that could exist, one internal thing could be to not be trained, but be familiarized with trauma-informed practice. Trauma-informed practice is just considering the potential traumatic events and consequences of the events, both on your service users, but on yourself as a professional. So you have 6 key principles in trauma-informed practice: safety, trustworthiness, peer support, let me think, collaboration, empowerment, and cultural, gender, historical issues. If you manage to have a teamwork, even in an OR or in a primary care, anything, you will be more sensitive and more sensible and more responsive to the potential distress of your coworker, and you will have spontaneously more not debriefing, but sharing moments, sharing experiences. How did you handle this? Oh yeah, but that's good. And it's changing our daily practice to make it trauma informed, rather than doing something extra that asks for more resources, more cognitive changes and input. And this is probably a way in.
Okay. So thank you, Dr. Mari, for your answer. Now, I would like to move forward with Dr. Sangeeta. Dr. Sangeeta, since you are working in the field of corporate world as well, you are a corporate trainer, and you have trained so many CEOs and so many executives in different parts of the world as well. So my question to you is, since there is a direct link between the work productivity and mental state of employee as well, so how can employers work with these? Let's say, how can employees work with their employees in the aspects of well-being, of mental health in the workplace in relation to COVID-19 crisis? It may be important to understand the mental health of employees regularly, but this may be more burden for employers to track every employee's mood every time, let's say. So don't you think instead of improving the productivity in the job, it is creating more burden? So we take this as need of temporary time, or it has a long-term impact in the case of productivity in itself? What do you believe, Dr. Sangeeta? I want to listen to your opinion, please.
Okay, this is my favorite topic. mental health at work and productivity. This is what I've been advocating for many years, right? Okay, so there is a link between mental health and at work. So let me just share a little bit, right? Okay, when we talk about mental health, when we talk about mental health challenges, most organizations did not look at it as it is, because they say, how can you justify this mental health is coming from the workplace and not something that is already built in or from the family? So it's been a long debate, because it's they need study, and in Malaysia we need to do more study regarding this, right?
Right.
Okay. So what they need to do from the employer point of view is to create a safe environment within the organization, meaning you create awareness. And confidentiality is very important, because most of the time when an employee express their concern to a HR or to a head of department or any other employee, the next minute, it's everywhere out there, right? So these are the concerns that people have. So what employers need to do besides create safe boundaries, review their policy, because right now, if you don't look into the mental well-being, you don't look at mental health, you need to fork out a lot of money, all right? Because the train takes a lot of time, a lot of money. When you talk about retaining an employee, also takes a lot of time, a lot of money. So that is why, instead of micromanaging, okay, employers need to look at results driven instead of presence. For example, if right now 4 of us are in this conference, right, in this webinar, and if you need me to be present and to be there all the time, I might not, because I might have different, because we are at home, I have my kids to address, I need to do few other things, domestic things, right? But if you let me know what's the outcome of the meeting, what do you want me to produce at the end of it, that is more important, because that is results driven. I know when I have my quiet space with me, I can deliver. Okay. And then set priorities. We do have employers who look at everything is urgent. So you need to set proper priorities and boundaries, so that you can see the productivity, you can see the KPI, the results are there. All right. And then use tools for collaboration. So when you talk about meeting, there's so many different tools that you can use. When you talk about developing or presentation, there's different type of tools out there. And right now, when you need to work from home or later, right, you need to understand people need time to learn new skills, especially those who are not youngsters, those who reach a certain age where they are so into moving out, getting things down, moving around to get things done. And right now, when they need to sit, right, for example, marketing, last time face-to-face marketing, right now you need to do digital marketing. So it's a new skill, new technique that you need to learn. So give the right amount of coaching, mentoring, time for them to learn in order for them to perform. So when they perform and they know that they are being supported by their employers, you see the productivity. You see that they are more willing to give, because they are mentally and emotionally secure. So these are the things that you need to do, right? And over time, it can be a long-term solution, because we do have employers who have team A, team B. The first week, team A goes to office, the team B work from home. So they take, what you call that? I just lost the word. Yes, rotation, right? They rotate. So this is the thing that you need to look into possibilities. So employers need to shift their mind into something that is different, which we call it the new norm, work from home. Evaluate your performance and your productivity by adding in these elements, because all this while they only look at physical, right? I need to go to the meeting, I need to drive, I need to be present there physically. But now it's different. So it needs to be conducive, your environment. So there's many other factors, but I feel that these are few things that it's easy to do it, okay, with the right support, with the right experience that they get from people around the community itself. They can help to develop this kind of environment. Yeah.
Right. But at the same time, people, mostly people are in the lockdown state, and they are facing so many traumatic cases these days. And after suppose if the lockdown gets over and they have to join the regular offices as well, in that scenario also, they will get impacted with so many psychological aspects as well, like taking care of their physical health as well, and taking precautionary measures to get rid of COVID-19 cases as well. So there are so many psychological scenarios, traumatic cases are being hit these days. But my concern is on the other hand side, employers, they are also concerned about the enhancing the productivity in the organization, because they have already lost their certain volume of business in this COVID-19 scenario, and this is going to impact a lot in terms of employers' perspective and employees' perspective as well. And there is a degree of balance is to be mitigated over there in order to proceed further in a very positive way. So both employers' perspective and employees' perspective has to be mitigated to a balanced line, so that there will be the physical caution regarding the physical hazards as well, and on the other hand side, that we have to be very cautious regarding the productivity as well, because both has to go parallelly. First, most important thing is health, right? So my concern is employees are having more concern towards the health, but employers they have their obligations as well. They have their own target as well, and they have already lost their business. And how these things are going to be coincided? What is your opinion, Dr. Sangeeta, and how employer has to react in this situation? What do you would like to suggest on this note particularly?
Okay, so if you look at it, it's always give and take. There's always two sides, and it's always need to be, because if you are coming from the employee point of view, it's right. Then if you're coming from the employer point of view, it's right also, right? So that clear communication needs to be there. Because you see, most of the time, I'm not sure in other part of the country, in Malaysia, sometimes the status plays a very important thing. And also, as an employer, they're supposed to know how to do things. They're supposed to have all the answers to it, and they need to portray those masks, right? So by have clear communication and communicating with their employees, saying these are the challenges that we are going through, these are difficulties that we are going through. We need the support. It's okay to just seek help. It's okay to share to them the employer's concern, and definitely you will come to a solution, right? Maybe short-term solution. Sorry, hello?
What I believe is, as a stable benchmark has to be maintained on the moment, I guess, because the benchmark that we used to design before, prior to the COVID-19 cases, and the benchmark that we are going to set up on upcoming days has to be different, because now people are in a traumatic state, and now the benchmark has to be lowered as well. So in order to maintain the balance between what I believe personally. Am I right, Dr. Sangeeta?
You can, because again, it depends on the individual. Some of them, they have a good high mental resilience. They can go through it easily, faster, and they recover. But some of them, they might take longer time, right? They need, so you need to understand what your body say, what your mind say, what your emotions say, and you need to come up with that. So having this communication, having to understand that, okay, you might lose something, but at least I have something that make me survive, to pay my bills, to get things. So these are the things that you need to look at, because if you look at it, not only Malaysian going through this pandemic, right? It's everywhere. So we all need to work together. There's no such thing as, my employer is not looking at my well-being because my mental health is not right. I need to have more rest. I need to have all this. But actually, if you look at it, it's just an excuse. You have more rest that you want, but then you use this as an excuse. So again, you need to answer those questions. You need to be clear to what your own expectation, and you have a clear communication, clear boundaries and expectations, so that when it's get across, you know the expectation.
Exactly. True.
Yeah.
Thank you, Dr. Sangeeta. Now I would like to move forward with Dr. Amoneeta. Dr. Amoneeta, in these days, what happened is, the education institutions are closed from almost 70 days in Nepal. I guess it has exceeded as well. So students are still in a traumatic state because of this pandemic. What consequences might be developed in the situation and how it can be dealt properly for protecting the mental health? So how can we bring this future generation to school, as it has, it was in the past before the pandemic, it was a very normal state, and how can we bring forward the situation in the upcoming days, let's say? So I think this may be more important point to be noted, that by global leaders, as these peoples are the future pillars of the country. The countries are in a lockdown state, and even the school, colleges, all of them are completely closed. In order to get rid of this COVID-19 situation. So you as a psychologist, what do you think? What strategies and what ways we need to follow in order to bring back our young generation towards these schools in the coming days, and how can we get rid of the situation in the coming days as well?
Yeah, excellent question. As I pointed out before, the people are quite vulnerable, right? Most mental health diagnoses start before the age of 25, so students are definitely at risk. But that doesn't mean all of them. They can, a lot of them, as has been pointed out by others and myself, can bounce back and be resilient also, right? So while many are going to be able to bounce back, there are going to be some select that are going to be adversely affected, and that we need to be able to support and offer support during this time. And so most certainly, schools and universities can normalize that any kind of reactions to these situations are quite normal. Students at all ages need stability, they need routine, they need reassurance, they need their leaders to be able to tell them, this is what is expected of you, this is what you don't necessarily have to do, kind of offering up-to-date and accurate information. Everybody at any campus, university, or high school or grade school, or down to preschool, can all be, all the staff, faculty, everybody can be supportive of each other. As has been said, we want to be able to recognize signs, right? So when you start to see people changing in their behaviors and their thoughts and what they say and what they do, being able to reach out to them and offer some of that psychological first aid and or referring to professional if this seems to be more extreme, right? We can bank on things like positive psychology that looks at hope, that looks at optimism, in order to build resiliency among our students. We can teach them about hope. We can teach them about happiness, about all these positive things, instead of just only focusing on the negatives. So there are certain things that do contribute to students' resiliency, to their ability to kind of bounce back from adverse situations. Such things as, we can teach them mindfulness. We can teach them very, very basic things. Something that I do with my students is just, let's take 30 seconds to get into our senses, right? You guys can do it right now. You can kind of listen to my voice. You can see the colors on your screen. You can actually, feel the temperature and feel the pressure of the chair against your back. You can taste anything that you can taste in your mouth. You might be able to smell something in the room. So just kind of mindfully getting into your five senses there can kind of calm people and put some perspective, right? Different adaptive coping strategies. So if we teach our students adaptive coping strategies and also normalizing that they're going to go on adaptive coping strategies sometimes, but just to kind of recognize those and try not to reduce those. Those things will be associated with less psychological stress. And then, of course, social support, right? Knowing that other people are going through similar things, being able to share, being able to talk to each other. These will definitely help students adapt, having people that they know that they can trust and rely on, whether that be staff members and professionals or among their peers. So any kind of things, even if they're being socially isolated, but any kind of socializing that can be done online, where people are actually interacting, the students are actually interacting with each other directly. That will help them all bounce back. And so, yeah, we need to be able to recognize that resilience in folks, offer, again, kind of routine, stability, building relationships as best as can be done in these kinds of situations. I think all of those things can help our students, and then, of course, help them be resilient to become the leaders of our future, those global leaders that we need to have.
Okay. So thank you, Dr. Amoneeta. Now I would like to move forward with Dr. Ghimire. Dr. Ghimire, organizations large and small in the public and let's say the private sectors have expressed deep concerns about the impact of COVID-19 on their people, productivity, and cash flow. Let's say. Recently, I have gone to one of the articles that, according to ACCA's new global research, among 10,000 respondents, including a panel of 226 finance professionals in Canada, for Canadian respondents, explain the most severe impacts include employee productivity being negatively impacted at 52%. Is the downfall in productivity is due to fear, financial insecurity, loss of job, challenges to face after COVID-19 situation, and so on? How can we maintain that? In what way our productivity can be enhanced in the coming days? What is your opinion, Dr. Ghimire, on this note?
So I think the first thing it leads us to is to acknowledge that an organization's health relies on employees' health. We used to dissociate both, like, an employee is here to be productive, and now we have to admit that if an employee is sick, it's bad for the employee and for the business, and we can't negate that anymore. Regarding, the downfall in productivity, fear, definitely. Financial insecurity, of course. Jobless or loss of jobs, it's quite obvious. But also transmitting or acquiring at work, because there's a legal liability here. And for instance, I know that in our hospital, there are people professionals who are COVID positive, and it's considered as a professional condition. And it seems nothing, but it's a lot for people's life afterwards, because if you are in this special status that your health issue is related to your work environment, that's a different thing from coming to work, being sick, potentially transmitting to other people, and it's a different mindset too. So there are very specific legal aspects to how the pandemic is dealt with in the professional environment. That's one thing. The other thing is, how do people consider coming back to work? If they can work remotely, that's not a big issue. And I think Sangeeta talked about results focused rather than task focused and everything. And it's really relevant. If you have to go to work, how can you ask people the strategies they already consider? Sometimes strategies are more top down than bottom up, but the cleaner will definitely know what to do and what not to do when people are coming in, because she's going to be the one cleaning the handle every time someone is going to open the door. And if we don't have this kind of consultation at all the strats and levels of an organization, we're going to miss the point. We're going to miss the expertise of people who would know how to handle it because they know their job, whatever it is. And we're going to miss this kind of empowering moments where they can share and share strategies, not just share their feeling or their experience, but share their strategies. So bottom-up consultation is probably a way to help people go back to work with safety measures that they already considered, and not just imposing measures that might not be relevant to some of their tasks.
After this lockdown gets over, people will be reluctant to go to a very, huge traffic places, let's say. So people will be reluctant to go to remote areas as well. So in that scenario, how the company can convince the individual, let's say employees, to go there after the post-COVID situation. So what strategy can be adopted as a psychologist? In what way the employer has to counsel their employees in the coming days?
So the first thing is, do they need to be at work? Because if they don't need to be there, it's quite likely that they won't go.
Okay.
That's the necessity principle. The second thing is, how do you change behaviors? And we have big literature on behavior change theories and techniques. Fear induction doesn't work.
Mm-hmm.
So don't frighten people. It's not going to work. And if you frighten people, it might have a very short-term effect. They're going to be afraid of losing their job and they're going to come back. But it doesn't mean that they're going to be productive or efficient, because if they come to work being super anxious for whatever's happening at home, because they left the 5 kids together and no one to supervise them, they're not going to be productive. So maybe, and I think it's always the same process: acknowledge, share, and support. If you don't know what they're going through and the strategies they already found or considered, you're just going to impose something, and it's not gonna work.
Thank you, Dr. Marty, for your voice. Now I would like to move forward with Dr. Sangeeta. Dr. Sangeeta, you are working in the field of mental health and workplace as well. Previously also I have asked several questions to you related with the workplace. Now, I want to listen from you. What minimum safety can employers ensure at the workplace on the moment in order to protect the mental health of the employees, let's say?
Employers, right?
Yes.
Okay. So I'll touch a few. All right. Okay. So when you talk about employees, it's all about financial and to have business and all that. Okay, one way that they can look at it is, have a crisis fund. Set aside a certain percentage from your sales, monthly sales, so that this will assist when there's crisis. So that, you see, most of the time, employers will have sleepless night a lot, because I've done a lot of coaching and webinars. So they say they're unable to sleep. Okay. And this is the contribution. It contributes to your mental health. So it can be set aside a fund, okay? And like what Dr. Marie was saying earlier, from bottom to top, have the cross-functional team to facilitate different things. Because you are good at this, but you might not good at different business units. So look into that, yeah? Again, ensure safety and review policies, because when you talk about occupational safety and health, most of the time they only focus on physical health, safety. They don't really look at health as per se in mental and emotion. So try to review the policies where it is more acceptable, by creating awareness, by advocating not only the employer, every business unit, every head of department, every employee needs to play the role. And for employees to be involved in mental health, they need to feel safe. They need to feel that they are being supported. So that is where the head of department, you need to advocate this, yeah? And also strengthen and enhance the culture. What culture do you have in your organization? If your culture based on fear, then I don't think it's a good culture to work in and to move forward. But if your culture is a coaching culture or people's culture, you get feedback easily and you get support easily. And then you can see if you have a happy working environment, you can see the productivity increase, the performance increase, and so many things will increase, and definitely your mental well-being will be, it's better, right? And then again, your interpersonal skill and communication plays an important role, because people always take things personally. When someone says something without understanding from where this person coming from, you have your own perception, then you start creating unnecessary personal conflict with someone else. So these are the things that organization and employee should work and look into different areas where they can implement first, because all these take time, right? Which one you think that, okay, this is good for us to implement first, so we implement that. At the same time, you have that process, you have that plan, because you need also to look at short-term plan and long-term plan. How can you work around it? And nothing is concrete. You can move, you can shift, because all these rules are man-made rules. You can shift according to the environment, according to scenario, situation, and feedback from your employees. Then you move forward with that. Yeah.
Thank you, Dr. Sangeeta. Dr. Amoneeta, we're at the end of the session, so I would like to listen one thing from your side. Nowadays, people are becoming more reactive. You know, in so many cases, you know, there is a high level of frustration, a high level of anxiety, and high level of depressions among the people as well. Even if you talk about the United States of America, you know, before the COVID-19 situation as well, 20% of Americans, they were in a position, they have ever experienced a state of depression in their life before the COVID-19 situation as well. So even after the COVID-19, so many cases has been increased, right? So these days, people are becoming more reactive, more anxious, and, you know, so many things are coming to their mind, and they're responsive to us. So many things that come across their mind. So how they can control this situation, and how they can bring positivity in their life. You know, there is a fear of, you know, insecurity after the post-COVID situation as well. And how can they normalize their way of thinking about the circumstances as well? How can they psychologically treat themselves to be you know, let's say, the bounce back to the normal after the post-COVID situation? What do you think as a psychologist, Dr. Amoneeta?
Yeah, really good questions there, and so you might be familiar with the idea of like a pressure cooker, right? That has a lot, as something's cooking, the pressure builds up and builds up and builds up, and I feel like that's what's happening right now, most certainly in the United States, with everything going on with COVID and the racial tensions and the issues that are happening currently, and all the shootings, et cetera, like that, and so absolutely, when we talk about mental health, within a society or within an individual, using that metaphor of the pressure cooker, it's gonna continue building pressure until we're able to let some of that steam off, until we're able to let some of that pressure off. And so from the individual level to the community level to the state to the country to the society level, we need to have valves. We need to have ways that we're able to vent some of those frustrations in healthy ways, be able to cope and express ourselves, whether again it be through writing, through online forums, through video chat, through some ways where people are able to have voices, and that becomes normalized. And so, you know, I've really enjoyed this talk with you all today, because I've learned a lot from the other panelists and from you also, Ananta, and have this opportunity to express these things. So I think we've said some of this before already, but to summarize, I think we need to normalize mental health reactions. We need to allow people to destigmatize it, to be able to express that in ways, places for people to go, right? Whether it be through their family and loved ones, or being able to seek professionals. I mentioned before the huge savings and payoffs if we invest in prevention now. So what better time than ever to invest in mental health prevention? That this is going to save us huge amounts, and you know, in every topic that we've talked about, from the economy to productivity to all of these different things. If we focus on mental health, all of those indices are going to increase. We're going to have greater productivity in our companies and our universities. We're going to have greater outcomes. There's going to be less social slacking and et cetera, like that. So I think that this can be a time that we can call for arms for huge mental health reform across the world, right? We can look at things in terms of how can we support this post-traumatic growth, not just in the individual, but within our societies, across the globe? How can we come out of this with a better mindset, a much greater balance in work, life balance, a greater balance between the mind and the body? As you ask those questions about diet and about exercise. How can we come out with a greater balance, both for for the environment and for us human beings? Obviously, people have been under these huge pressure prior to COVID, and it's just kind of building up with this. How can we encourage a society of compassion, of caring, a society that really supports each other, a society that's open, to all the different types of people, that all the intersecting identities, right? In psychology and counseling, we talk about how every individual is not just one culture, but an intersecting culture of all these things. And obviously there's a lot of discrimination and racism and inequality that COVID has highlighted across the globe. That has been touched on here. I talk about some of my own privileges of being able to, access, and others have talked about, people having privilege to be able to access, to stay inside, to stay safe, to get medical care, to get psychological care. And not everybody has that. So if we can encourage this kind of world that is more equal, more compassionate, and more caring, I think that's the direction that we need to go.
Thank you, Dr. Amoneeta, for your very wonderful answer. So I would like to move forward with Dr. Marie Chollier, and then I would also like to wrap up your speech as well. So since you are, psychiatrist at a hospital at Paris as well, you are, a very senior, let's say, professor at one of the reputed business school as well. So my question to you is, what sort of symptoms are being seen in this COVID-19 situation in terms of psychological disorders, right? So you might have experienced so many calls and so many, cases in your hospitals by phone calls, receiving personal phone calls as well. So what sort of cases are being seen, and how can a person can know that he's being impacted by the psychological distress and so many other psychological trauma is being created? How one can understand the situation? Can you please elaborate on that particular note, Dr. Marie?
Okay, so how can one understand he's going through some psychological distress?
Yes, exactly.
Okay, and it's probably the first key point, because you might be distressed and you can't see it. You can't see it because it's normal to be angry. You are in a dreadful situation, so you are not going to ask for help, or you're not going to share these things if you think it's completely external. And external attribution, thinking it comes from the outside, is one of the first reasons why people do not acknowledge psychological distress. So whatever you experience, how much is related to the situation and how much is related to what you actually feel, whatever you feel. Some people will express distress through tears, sadness, anger, withdrawal. It's very individual. We will all handle this in a different way. The question is, how much of your usual resources are impeded? How difficult is it to perform very simple tasks? Waking up, going to sleep, cooking, calling someone you want to hear from, calling your mother to know how she's doing. When simple tasks become very difficult, that's a sign. And that's the first thing people should be aware of. If it's 1 or 2 days, maybe it's just, transitory. After 2 days, maybe just acknowledge that it's difficult and share it with someone. But yeah.
True. Please. Because the majority of a case, we can see that, in majority of the cases, people, they are in a position to acknowledge that they are actually in the state of trauma, and they are not in a position to understand, acknowledge the, symptoms of, the state of depression, the state of anxiety, and something like that, So, they eventually know about it when the situation get worse. So that is the scenario these days with the people, and what actually I want to make the people clear for your viewpoint is, suppose if people are not in a position to understand the things very clearly, if they have a confusion, if they have, let's say, if they feel difficult in carrying out the regular task that they are doing on their own, so that is the symptomatic cases of anxiety and depression. Is that what you mean, Dr. Mari?
Not always depression. I think we're not at the stage of trauma. We're not at the stage of trauma yet, or some people might be because of their, background, adverse childhood events that are triggered again. We are in the acute stress moment. And we will all handle stress differently. Some people will develop OCDs, and with this pandemic, it's very easy to wash your hands 50 times a day and have various skin problems. And it's okay. It's okay because it's reassuring, because you feel safer because you did it 50 times today, and tomorrow maybe 60, because you feel so much safer when you do it. That's something, some people will have this kind of behaviors. Some people will have negative emotions. Some people will have negative thoughts, whether it's stress, anxiety, depression, something else coming up, something you just dig years ago and it's coming back, because when you're sad, you go out with your friends, you have a tea or something, and it goes. Now you can't do that anymore. You can't cope as you used to cope. So look at your coping strategies. They're not the same anymore. Look at your coping strategies and share how you feel. I can't tell you what is depression and everything, because it's going to take various shapes.
True,
and before the psychologists,
yes,
before
we
the
can assemble the and we can reflect it out how symptomatic it is, the cases, if we want acknowledging the scenarios. So thank you very much, Dr. Mari, for a very wonderful point. So lastly, I would like to go with Dr. Sangeeta. Dr. Sangeeta, let's wrap up this session. In what way the people can maintain themselves? Basically, I'm talking from the employee's perspective. After the post-COVID-19 situation, how can people get bounced back to the normal situation, and how should they react? What strategy they have to adopt psychologically, so that they will be in a position to understand the scenarios, and they can cope up with the scenario, they can cope up with their colleagues, and they can work more effectively in the organization, even after the post-COVID-19 situation. Because sooner or later, the office are going to be open in most of the part of the world. The office are already open, but people are still hesitating to be very nearer, very closer, and then they are also, having so many differences in terms of their working modality as well. So in some way around, it's very important and essential as well. But in other way around, if you talk about the productivity, if you talk about the organizational, let's say enhancement of the tax at the organizational level, so we need to be something that the organization demand us to be as well. So in that scenario, as an individual, suppose me as an employee, how I should be prepared for the post-COVID-19 situation more proactively than reactively?
I think the first way, the first thing that you can do is, if you are not sure, ask your direct superior or the head of department about what are the safety precautions that the organization has set it up. Yeah, you ask so that you understand, and also ask for the roles and responsibility that you need to address, because there are certain things right now. With lay off, retrenchment and all that, you might take extra work. So you need to understand that what I need to do, what is the priority, what can be delayed, and what you need now. So that is all communication, where you need to have a clear and courageous conversation with your employer, the head of department, and all that. Secondly, you need to make sure that you see, people tend to overthink, right? And when they overthink, and you see, there's a study says that we have 60,000 thoughts in a day. And from there, 85% can be a negative thoughts, and it recurs, and it will develop, and you start to overthink for the same thing. It can brew so many times, right? So address those thoughts. If you think that by reading, by watching, by associating with people who brings negative cut it off. I know it's easy to say, but you need to have the discipline to stop all these negative things, news that influencing you. Another thing that you can do is self-care. Be mindful, like what Dr. Amoneeta and Maria say, be mindful of your well-being. What are you feeling right now when you are at work, or while you are meeting client, or while you are communicating with your colleagues and all that? Be mindful and reflect on that. Reflect on, every night before you sleep, or if you have at least a 1-2 minute, just reflect and write it down, because it really helps you in terms of your mental well-being. And not only for employee, it can be to everyone, to anyone. Because when you go through this, then it's easier for you to go back and, hey, I have this similar situation, this similar emotion and thoughts, and it might recur, after a few days or after a few weeks. So by addressing that, you are more in control of yourself. You have the power to do. And most of them, people give away their power. So when you have that control, when you have that power, it will be clearer for you to do certain tasks. It will be clearer for you to communicate with others, to tell what is running in your mind, because right now you are clear. When you are clouded, you cannot express as what you want to express. You think it will be too personal. You create unnecessary tension. And this is for all of us. We always create unnecessary drama, right? So have that clear boundaries, reflect, mindfulness, understand from where you're coming from, ask if you don't know, don't assume. So all these are helpful for your mental well-being. Yeah.
Thank you very much, Dr. Sangeeta. Once again, thank you all the entire panelists from different part of our world. Dr. Amoneeta from United States of America, Dr. Chollier from France, Dr. Sangeeta Kaur from Malaysia. Thank you one and all. Thank you all the audience who are watching us live through Uniglobe College Facebook page and YouTube page as well. So thank you one and all for for your wonderful participation. And most importantly, I would like to thank personally on behalf of Uniglobe College to the entire panelists from different parts of the world, from America, from France and Malaysia. So thank you for being here, and thank you for sparing your valuable time, and thank you for sharing your valuable thoughts to the audience over here. In the future, we would like to welcome you on different set of programs as well. Once again, thank you one and all. Thank you very much for today's wonderful discussion. Thank you. Namaste.
Thank you for having us. Namaste.
Namaste. Thank you very much.